Hello, my name is Eliana Lopez. Vulnerability. Results from an interaction between the resources available to individuals and communities and the life challenges they face. Individuals with substance abuse disorders are extremely vulnerable. Currently, 40 million people have a substance use disorder, and their vulnerability is enhanced by race, ethnicity, age, sex, and income, insurance coverage, stigma, and criminalization, among many other factors. Substance use disorders are characterized by repeated use of a substance despite its negative effects, whether addiction is the most severe form of a substance use disorder. Substance abuse rates in 2015 account for 22.7 million people, and as we can see, more males, native Indians, and individuals aged from 18 to 25 account for the highest substance use rates. The effects of addiction reach across the lifespan, across cultures, and across genders. Drug abuse affects those at all levels of society, and no population group is immune to substance abuse and its damaging effects. As we could see, we have to have a special consideration for specific populations, and here I included a few of them, especially for Asian, lesbian and gay community, veterans, and incarcerated people. There is a profound gap in care. This gap is due in part to decades of criminalizing substance use and the negative public attitudes towards this serious problem. Today, only 1 in 10 people with addiction involving alcohol and drugs other than nicotine receive any treatment. And even those who do receive treatment do not receive anything resembling evidence care. Risky substance abuse and addiction undermine education and academic progress. Statistics show that most individuals with a substance use disorder had only a high school degree. Some statistics show also that the unemployed people tend to use more drugs, but there is actually a higher number of users that are employed full time. And we can see that in the numbers there. And then the socioeconomic status seems not to be such a big variable and seems to affect mostly the drug of interest rather than the percentage of actual users. And we can see that in this graphic below. Some psychosocial concerns we need to account for are coexisting mental disorders, social isolation, concurrent disorders, and underlying cause of disease, such as in veterans with PSTD and our gay community that faces so many challenges. Risky substance abuse and addiction together constitute America's largest health problem, causing or contributing to more than 70 other conditions requiring medical care, including cancer, respiratory disease, cardiovascular disease, sexually transmitted diseases, pregnancy, complications, and trauma. Um, they also account for many cases of psychiatric conditions, and they may worsen or increase the symptoms of depression. As we can see here, these are the rates of emergency room visits, drug use, um, the dangers of smoking, in the link of cancer to substance use, and with gastrointestinal disease. The challenges are really big, and many health problems can arise from substance use and abuse. Um, as I mentioned before, drug abuse is a major public health problem. Substance abuse costs taxpayers billions of dollars each year, and in fact is among the most costly health problems facing the United States. Many of America's top medical problems can be directly linked to drug abuse, like cancer, heart disease, HIV. Many of America's top social problems also relate to or impact drug abuse, such as drug or drunk driving, violence, stress, and child abuse. Substance abuse affects everyone at the end. Homelessness, crime, um, lack of education, um, um, workplace issues, deaths, child abuse um, can be, in many cases, linked to substance abuse. Some of the risk factors associated with substance use are early aggressive behavior, poor social skills, and lack of parental supervision. And some of the protective factors are self control, positive relationships, anti drug policies. Prevention approaches aim to enhance protective factors and to reduce risk factors. There is considerable evidence showing that prevention, treatment, and recovery policies and programs really do work. Some examples of this at the primary level of prevention include minimum legal drinking age laws. Secondary prevention includes early detection and counseling, and a part of tertiary prevention would be like rehabilitation. Our primary goal as nurses is to integrate primary and behavioral health care so that way everyone can get treatment. And the major role of public health is to protect and improve the health of the overall population. Here you can see some local programs for my community. And they are targeted at different populations, such as pregnant women, um, elderly, and kids. Using all these resources has been shown to be effective in preventing, reducing, treating, and sustaining recovery from substance misuse and substance use disorders. Thank you.